Hi, good morning, good afternoon, good evening to all of you. Thank you for joining. My name is Danjuma Adda. I'm the President, World Hepatitis Alliance. I want to welcome you to this community forum, and thank you for finding time to join us on this great event. This is the first in the series of our World Hepatitis Day event 2022. And as we join, please, we'll take the next 1 or 2 minutes to wait for others to join the call. And so just sit back and let's wait for some few minutes as we add more people to join the call. But thank you so much for joining and finding time to be part of this great event. Thank you. I will just hold on for a while. Thank you.
Every 30 seconds, someone will lose their life to hepatitis. Hepatitis can't wait.
I can't wait to get tested.
I can't wait to start treatment.
I can't wait to protect my children.
I can't wait for a world without stigma and discrimination.
We can't wait for a world without hepatitis. Together, we can make it happen.
Hepatitis can't wait.
La hepatitis no puede esperar.
Hepatitis مش هيستنى.
Hepatite não pode esperar.
L'hépatite ne peut plus attendre.
肝炎等不了了。
Great. Thank you so much for that beautiful, inspiring video. So thank you, everyone, for attending. As I did mention earlier, that this is a community forum, and it's a forum for all of us to share experiences, to discuss, and then to hear from you about your stories and to tell us what you do. So we have a great panel members of advocates who are going to be on the panel to share with us their stories. But let me, as I mentioned earlier, please, I will invite you to speak, and all attendees will be given opportunities to speak. So if you want to speak, you just raise your hands and then indicate when then you will be called upon to speak. And just also to let you know that we have interpretation, so translation into different languages. So you might just want to go to where there is interpretation, click on it, and then you choose the language that best suits you. So for English members, select the English version or the icon that talks about English, and you will be able to listen to all the discussions in English language. For Spanish or French, as the case may be, you will have the translation in the language that best suits you. So we're going to have various topics to have discussion today. Please, this is a forum for not just the panel members, but this is a forum for also you, the audience, to share your stories and to participate. So as I mentioned earlier, my name is Danjuma Adda. I am the President, World Hepatitis Alliance. And you'll know that the World Hepatitis Alliance is the umbrella body of over 300 member groups across the world. And we're led by people living with hepatitis. I also live with hepatitis B, and I've been with this right from the time I was diagnosed in 2004. We have on the panel also great people that are going to share their stories. So these are the topics we're going to actually discuss today. How do we tackle the stigma and discrimination of living with hepatitis? What can health professionals, community organizations and the private sector do to address the stigma? We'll have different panel members to share their stories. And what roles do community and advocacy have in prevention of mother-to-child transmission? And what more needs to be done? What can be done to better support people living with hepatitis and their mental health? What are the needs of people living with hepatitis and other conditions? How do we better support people holistically? So I'm going to hand over to the panel to introduce themselves. And please, may I ask that, because for the sake of translation, you speak gently but audibly, slowly, so that we'll be able to understand what it is your own perspective, and you share with us your story. So I will call on each of the panel members. They will introduce themselves before we go on. But however, before I go on to introduce the first question. So here are the panel members. We have Dee Lee. Dee Lee, can you introduce yourself and tell us who you are and what you do?
Hi, this is Dee from China. The past West Pacific, the board member of West Pacific region in World Hepatitis Alliance, and also now sitting in multiple, boards of the community organization for hepatitis and liver cancer. Thank you.
Thank you, Dee Lee. Lien. I think, Lien, you're muted. Can you unmute yourself and introduce yourself, please?
Yes, sorry for the confusion and the wait. Thanks for the patience. So good evening, good morning, good afternoon, everyone. So good evening from me. So my name is Lien. I live with hepatitis B, so is my mother and my maternal grandmother. I'm from Vietnam. So currently I'm a researcher at the WHO Collaborating Center for Viral Hepatitis at the Doherty Institute in Melbourne, Australia. My research focused on hepatitis B care delivery in primary care. So I have been in the fort talking about my personal experience to raise awareness about hepatitis in the last nearly 10 years. So I'm so happy to be here. So currently, as a Vietnamese living in Australia, together with some other people living with hepatitis, we are running a focus group, a support group for Vietnamese living with hepatitis B in Australia, with more than 700 members. So glad to be here and happy to be with everyone.
Thank you, Lien. Thank you for your great story, and thanks for being part of the board of the WHA. So can we have Luis, please introduce yourself and tell us what we do?
Hello, thank you for inviting me. My name is Luis Mendão. I'm someone old living with HIV and cured hepatitis C, but my liver is still very damaged by the 35 years that I lived with hepatitis C. My organization is a member of World Hepatitis Alliance, and I'm also in the board of the Liver Patient International. I've been concentrating more and more energy in fighting for access to treatment, early diagnostics, and care for people living with hepatitis, and of course for elimination of stigma and discrimination. Thank you.
Thank you, Luis. A great advocate, and it was great meeting you in Geneva during the World Hepatitis Summit. And I'm always inspired when I listen to your story and the great work you do. So thank you for being part of this, Luis. We really appreciate the time. So can we go to Silvana? Introduce yourself.
Hello, everyone. I'm Silvana. I'm coming from Bulgaria, and I'm a patient with hepatitis B. Since 15 years ago, we started a group of patients. We started our association And currently, for the last 5-6 years, we've been focusing on screening linkage to care, involving in government politics, and but also we try to support patient in everyday life, because life of patient, it's not always treatment and politics, but sometimes it could be something very simple as can somebody hear me and share my feelings. So I'm really happy to be here, because although I don't know many of you in personal, I feel that I'm among friends, and for me it's truly an honor to be here today.
Thank you, Silvana, and thanks for the great work you do. It's a pleasure to have you as a panel member. Can we have David? You're a great guy, met you in Geneva, so inspired with the story of what we do. David, could you introduce yourself, please?
Thank you, Danjuma. Hello, everyone. My name is David Urick. I'm a 33-year-old hepatitis B patient living in Michigan in the United States. So in 2019, I had just gotten a liver biopsy and had started a medication regimen, and I was feeling pretty lost as a hepatitis B patient. That was until I saw a video made by a woman with hepatitis B. She shared her story so eloquently and beautifully that it actually affected me to the point of becoming a hepatitis B patient advocate. So most of the work I do involves simply sharing my hepatitis B story and all the struggles and successes that have come with that. This can be through writing or in person through webinars or in person. These have been in front of groups of people that have no knowledge on hepatitis and people that have lived with this for most of their lives. What I've learned recently is that storytelling is the most powerful tool we have as patients to build empathy and connections between communities. And it's a pleasure and honor to be here today. Thank you.
Thank you, David. Thank you. Meeting you in Geneva, I was really so happy to listen to your stories, and you really quite inspire young people. And it's great to have you join the Voice in Advocacy. Thank you, David. Now, I'm going to throw this opportunity to you participants. We don't just want to listen to the panel members. So for the next 5 minutes, if I would like to welcome any audience members who want to share their journey. You want to share your journey with hepatitis. If you want to do that, please, you could just raise your hands and then I identify you and give you just a minute to share your story. So I have Philippe Eugene. Please pardon me if I'm not able to pronounce your word very well. Yes, thank you. Guanji Philippe Eugene, I think you are unmuted. Aha, thank you.
Yes, thank you very much for giving me the floor. I'm Guanji Philippe from Cameroon. I work with an organization named SOS Hepatitis, Cameroon. So we have been doing some activities since 2019 in favor of mother-to-child prevention of the transmission of the hepatitis B. Besides that, we have organized many workshops with stakeholders on hepatitis fight in Cameroon and the government to improve the fight. So we have launched a program named No More Hepatitis Before 2030. So we are planning to screen about 50,000 people.
Okay, thank you.
And
Eugene,
we are going to start.
Want to hear more about your personal story, about your personal life, about how it has been with you on hepatitis. So for every other person that is going to speak, please, it's about your journey with hepatitis. And then you now piggyback into the activities you do. So it's not about activities, but your journey with hepatitis. So I'm going to call on Han Yang Chung, please. It's your turn now to speak. Thank you. After that, we have David Klein. So, Han, please, could you unmute yourself and speak, please? Han Yang, please, could you unmute yourself and speak? All right, can I go on with David? David Klein, please. David?
Hi there, can you hear me?
Yes, I can hear you. Thank you. Go ahead, please.
Yeah, hi everyone. I'm from Brisbane and I in Australia, and my journey started when I was a young child, going through state homes and 9 or 10 different state homes as a young man, and then starting, like 15 different homes and institutions that I was put in, and then as a young father with 4 children in my late 20s, I got diagnosed with hepatitis, and during my childhood, I went through a lot of that yucky stuff what state children went through, abuse and sexual and physical abuse, and then anyway, I got diagnosed with hepatitis as in my mid-20s, and in those days, in the 80s, stigma was horrific. I actually got told by a doctor at that stage. I got diagnosed when the campaign of AIDS was going around in the 80s. It was horrific. And they said to me when I had my 4 kids at the hospital, "Sir, go and get on with your life because you're probably not going to be here in 5 years." And as a young father with 4 kids in hand, I was more than in shock. And the stigma was so bad in them days that my whole family got ostracized by it, and it made me move from my own country to Australia, where I went to a clinic that was very, very up to date around AIDS and hepatitis, the gastro, and it engaged me as a patient. And now I'm an advocate for person-centered care, where we come from. And the most thing that I say to doctors, I've been in the system for 40 years. I've had a kidney transplant, a liver transplant, diabetes, arthritis, gout. I had 2 brothers with all the same health issues, and they lost their battles in their 40s. I got through the system because of person-centered care. My doctors that know me best know where I come from, and this is the message I'm trying to get out to, whether you're a person or patient with hepatitis or any disease or anything, is that our trauma and our lifestyle, what we experience in early life, come with us on our whole journey for the rest of our life. And going through double transplant, kidney and liver transplant, I suffered delirium. And while my treatment was going on for 10 or 15 years, at the most busiest time, and surgeries, that with the delirium, it played a massive part of my well-being. And the nurses and doctors that treated me with care is why I'm here today. I'm losing my sight. I've been cured by I've been cured by hepatitis C. I'm losing my sight now. I've got retinitis pigmentosa. So I've been on a massive journey for 50 years, and I still say I'm the luckiest person in the world because I'm still here. Wow. And I put it down to a couple of things. And I've been a basket case over those times. And then about 20 years ago, I thought, right, I'm the person that's going to control where I'm going in my life. I changed the way I eat. I eat as healthy as I can. I have my own garden. I look after my mental health the best I can. I keep away from a lot of messy business, and I'm still here today, and I'm 63 years of age, and I've had 4 doctors over the years write me out, long written me off. So I say to a lot of people that just live for today and learn to love yourself. Thank you for the time.
Oh my, this is quite inspiring, David. I feel quite touched, and I know everybody on this call in this room is really quite touched to hear this personal, moving story. And I think we'll be very happy to have someone like you to always be there to share the stories. So thank you so much for sharing this very, very touching story. Thanks a lot, we appreciate it. Can I have Prince Okendo, please? Just 1 minute, please.
Okay.
Yes,
Hi, everyone.
Your journey with hepatitis, please.
Okay, thank you very much, World Hepatitis Alliance, and Dr. Danjuma, thank you very much for the opportunity given. My name is Prince Okendo from Nigeria, and my story, actually, I discovered I'm living with the virus 2018, thereabout, just 2018, okay? And it was by chance. I was actually preparing for my wedding when I discovered that. And so my wife and I, we had to do the screening. She came back negative. Mine was positive. But we went through with the wedding because she quite understood the situation, and then we had to, get her through the series of vaccines, and then she's been vaccinated. Okay, and then when I discovered, at that point I was really confused, and really didn't know what much to do about the situation until I started following the Hepatitis B Foundation, and then getting advocates talk about their own personal life stories, and that got me motivated to now set up an initiative that will help those who are also positive, who perhaps may not even know, to help them go through these things and then understand their current health status. And mine was actually from mother to child, because the moment I discovered, I actually had to do screenings for my siblings and my parents, and I realized that my mom actually, she's positive, and then my grandmother also positive. So it means it came through from my grandmother to my mother to all my siblings, except the last one who she escaped that because she was vaccinated. At the time she was born, she was given the vaccine. Though my mom didn't know, at the hospital, the last born was born. They actually gave the vaccine, and so that was how she was able to escape that. And my cousins and my aunties, all of them are also positive. And so, I took the initiative. I decided to set up the Hepatitis B Advocacy Initiative, okay, to advocate for better funding, screenings, vaccination, and it's a whole lot. But I think I'm very grateful to know of the World Hepatitis Alliance. And I was excited to see my brother, senior brother, Danjuma, who's from Nigeria, also doing a whole lot. And I would appreciate if I get more of these, if we get more of these, to encourage us to continue to advocate for a better government intervention. Thank you very much.
Thank you, Prince Okinodo. It's really great to hear from you. And I think listening to people from this region sharing their stories is quite inspiring. And sorry to hear about all the relatives and all the people in your family, but it's good that you stand out to really share your story. And I'll be happy for us to connect to know what you're doing in Nigeria and what we could do to support your work in advocacy in the country. So let us keep in touch, please, and let's know how we could strengthen the role of advocacy and your voice in the country. Thank you so much, Prince. Yeah. So we'll round up with this on this session with Milan. Please, Milan, we'll round up with you sharing your story very briefly. Then we go on to the panel members. Milan, great guy, great friend, great advocate. Let's listen to you now.
Thank you very much, Junama, dear friends, Dee, Silvana, Luis, all present here. It's my pleasure to be today with you, all of you. I late a little bit, a lot of meetings scheduled day by day, but it's very nice that we have the opportunity to discuss and to speak about the next initiative, how to stop the stigma, and especially the part with the access of the treatments. For me, one of the biggest reasons, I will say, like a patient advocate, about the stigma is that the access of the medications. If you have the access to the medications, you don't have the stigma, especially with hepatitis C. Now we have two goals to achieve. One is if it's possible to be achieved, is 2030 WH goal, and the second one is the micro elimination process with the risk groups. I think if we don't have it in this moment, possibility to have a special vertical program, which will help the low and the middle income countries, is going to be still a huge stigma in these countries with the population with hepatitis C, especially. And how we can avoid this? This is a quite tricky question and big challenge for us. But one of the steps is the micro elimination process through working together with HIV community, harm reduction in everybody in the process of micro elimination. Why we need this micro elimination? If we achieve process.
All right, thank you, Milan. I think I'll need to jump. Yeah, I'll need to jump in because of our time, but we appreciate your contribution and thanks a lot for sharing. So I'll need to jump in to interject at this moment. So we will go on to the panel members. And my apologies, Milan, sorry for cutting short your sharing your story. So we'll just go on with the panel. And the first two panel members to discuss would be Dee Lee and Lien. And so the question to you, and you have 5 minutes each, is how do we tackle the stigma and discrimination of living with hepatitis? That's the first question. And what can healthcare professionals, community organizations, and the private sector do to address this stigma? So the first set of the question is, how do we tackle the stigma and discrimination of living with hepatitis? Dee Lee and Lien, you have 5 minutes each to discuss on this. Thank you. Hand over to you.
All right. So Lien, I'll take the liberty to start off first. Thank you for giving me the chance to speak first. And thank you, President, for giving me this chance to speak to the community again. And normally I'm going to share most of the time to share my story, but after listening to David and the other folks' stories for the community, I might just leave everyone to ditch into the same, the feeling of the discrimination and stigma against hepatitis for a little bit while, because this is our story. It's just not about who spent 15 years digging here in the community to fight stigma for 15 years down here like me. So I'm going to share a little bit more before how, share a little bit more what before the how. So the first thing is about where is the stigma discrimination? Now I'm going to use China as an example, because as everyone knows that China has the largest number of hepatitis patient and people living with hepatitis in the world. So in the hepatitis, discrimination and stigma, stay in the workplace mostly. So by sharing you a small story, in 2003, Joe, a public servant, awarded employee, he was sacked because of, even though he got the chance to work as a public servant, but he was sacked only because he is a hepatitis B patient, or maybe a person living with hepatitis B. He went inside, stormed inside of the office and killed 2 people instantly, and he was sentenced to death. There's a tragedy. But still now, maybe you can say it's 2003, it's a single issue, but still nowadays, there are many departments refusing people living with hepatitis to work in the workplace as a public servant. When we talk about schools, there's a number 2, the second place where the stigma and discrimination would happen. In 2015, a college student, Wu, committed suicide only because she has to be quarantined in the room for her identity, identity of being a person living with hepatitis. In the class, he was sentenced. He was moved into the quarantine room for 2 weeks, and then she committed suicide by burning coal inside of the in the room. The same situation happened over and over again, especially predominantly in the kindergarten in China. When talk about the family, that's the third kind of places that the stigma discrimination would happen. Thousands of mothers, I mean talking about hundreds and thousands of mothers, even though Pmtct is widely used and highly successful, but still they have to abort their children or child only because their mother-in-law or maybe father-in-law or maybe their husband asking these women to say, you have to abort it because I'm not allowed to have a hep baby. There are a couple of tipping points here for the stigma discrimination. Screening and vaccination. When we have the screening, there are loads of people will be they are aware that a person living with hepatitis. People keep circulating around who are the hepatitis B carriers. I'm so scared of him or her, and then there's a whole lot of discrimination that really show up. The second thing is about legalization of banning the discrimination, where there are many news and many tragedies show up onto the platform of the news every day. And third tipping point, guess what? It's coming, and it's coming very soon, I guess, I hope, and I wish, which is the functional cure. You need people to come out to say, I'm a person living with hepatitis. I need a cure, but I need to have my identity exposed. So when we talk about, is it a singularity case in China? No. ASEAN country has the same issues. Thailand, Cambodia, the STI and HIV/AIDS are widely discriminated. And then we assume the hepatitis will be coming up, following the steps. Philippines, workplace, Malaysia, Singapore, where Chinese community and TCM influence are very popular in those countries. What we can do to really get engaged with the, to make sure that the hepatitis, the discrimination and stigma against hepatitis will be, acting in a very, very low level of influence. Policy making, we have to squeeze every bit of the, the policy to help us to stop the discrimination. The second thing is to value each case on the news against hepatitis, because that's where we can make advocacy, make people's stories highly aware. And the third thing is we need you, community. We need more hepatitis activists, which is we call hepativists. You have to stand out to, fight against the hepatitis.
For your time.
All right. That's me. Thank you.
Yeah, thank you, Dee. We'll go to Lien. Thank you. Beautiful, beautiful, Dee. Wonderful. So, Lien.
Yeah, thank you very much, Dee. And I think I feel the same, that we have been talking about our stories for so many years, and sometimes feel that, right, have I talked enough? Have the people in the audience already heard my story? And then, yeah, is it a point of talking that again? But yeah, I will take your advice of being, activist to once again talk about some of my experiences with like in my encounter with health professionals. And then hopefully, I know that it was not my experience only, but also other people. So hopefully to provide another voice to let health professionals know about that. So I guess encounter one, the one that actually changed my life, in a positive or not so positive way. So what happened was that when I was at college, when I was at college in Vietnam, I secured a scholarship to study at a university in Europe. I felt really fortunate and proud because I was the first person from that small village in the northern Vietnam to get that opportunity to go to Europe to study. And as a part of the paperwork of the scholarship, I had to do a health check, and hepatitis was in the list. I won't tell what was in, it's just they gave me a list of things and asked me to go and take the blood. So when I came to get the results, the doctors at the health check department told me that I had hepatitis B and that I would therefore not being able to go overseas. So I did not know about hepatitis B, and also like a girl just got out of the village to the big city. So I did not question his advice. So I blindly trusted him and rejected the scholarship because I heard that I could not go overseas. Then it was only when I was older, like now, I knew that the doctor was wrong. I could have taken up the scholarship. But anyway, losing my scholarship was not the worst part of the diagnosis. I was not given any further information about hepatitis B then. The only thing I knew about hepatitis B, is that by that time it was a liver disease. And because like simply in Vietnamese, hepatitis B is read liver inflammation type B, and the liver was there. And because my grandmother passed away because of liver cancer, so I thought I had the exact same thing. And so I thought I would die too. I was given no information about the reality of living with hepatitis B. So going through the fear and the devastated stages, and now I'm still here knowing a lot more about hepatitis B, knowing that I can live well with hepatitis B. And to be clear, it was not because of the doctors who diagnosed me back then in Vietnam. And my second encounter, like with the doctor outside of the clinic. So that time I was breastfeeding my first child, and I had some excess milk, so I stopped them, like just in case someone need that. So I was asked by a couple and was happy to share the stop with their premature child. So I did not talk about my hepatitis B status by then, so people didn't know. But by that time, I felt like I had the obligation to tell them. And I knew that one of the parents was a doctor. So I showed them my hepatitis B viral load result, which is like not detected, and that I was breastfeeding my child directly. They said they would think about that. And then a few days later, they said they didn't need the milk anymore. So for many years when I worked in hepatitis, I heard people talk about destigmatize, about resolve the stigma and discrimination about that, and they put awareness as an important point. So I guess so for my case, so awareness works for the first doctor. So he could have given me the right information, so I could have done. I could have still taken up the scholarship. But like for the second doctor, I thought it was not him or her. I'm not gonna tell who, which parent, not knowing about that. And I showed them about like all the clinical content. And I guess they had enough methods to verify, like to know how that would be, but then they decided not to take up my support to their premature child. So I guess awareness is one point, but more importantly, that's love, that's understanding, that's empathy. And I guess like I was lucky because I was met with empathy when I disclosed my status with my boyfriend back then, who is now my husband and father of my 2 beautiful children. So I guess, yeah, that's love, empathy. That's, I think, the key things to end stigma and discrimination, that we need to speak more about that.
All right, Lien, thank you so much. Hope you don't mind if
I'm done.
Lien, thank you. Sorry. Yeah, thank you so much. I always get moved when I listen to your story, and it's really quite interesting, honestly, listening to your personal experience. And so now I want to throw it open to the audience. I want to welcome if maybe any of the audience would like to share additional thought on stigma and discrimination. Panelists, maybe any other panel member first. Any other panel member that want to share maybe additional thought on stigma and discrimination? It's open to you, either Louis, Silvana, or David, any one of you, before we go to the audience. You have just a minute for that, please. Any panel member?
Yes, I would like to. I just
okay, Silvana, please go ahead.
Yes. Yeah. While I was listening to Dee and to Lien, I was keep thinking that they're so right, and we should perceive and ourselves as not like we are not the disease, we are not the condition. It's just such a small and tiny part of our life, and we cannot let the virus define who we are. And we are much more than that. Personally, we are a universe of feelings and thoughts, and we cannot let one virus destroy our life. So I would like to encourage other patients, because I've been in this for a very long time, and I would like to encourage other patients to step out, be brave, and just to not care about what other people think, because when you are secure in your heart that you're right. So be brave and don't stop anyone, and don't let anyone tell you that you're something less than the others. Yeah, that's it.
Thank you, Silvana. Any other group, any other panelists want to shed more light?
Sure, I'd like to just add a little bit to what
Silvana, do you want to maybe lower your hand so that we don't think you still want to say something? Okay, go ahead, please, David. Go ahead.
Thanks, Tim. So yeah, piggybacking off what Silvana was saying, I'm someone who has not been doing advocacy work for very long. I'm pretty much a newbie to this world, but in the 3 years I've been speaking on my story and meeting more and more people in this community, there's a certain momentum that can build within yourself when you start to really take hepatitis and sharing who you are and your truth inside to the degree of what you need to express yourself. There's a certain feeling that happens, and it sort of has propelled me into all the speaking I've done on my story. And it's just, I would encourage everyone else and all patients watching this to, if you can find the bravery, do it, make that leap.
All right, thank you, David. Luis?
Yes, I just raised my hand for an experience that we have here in Europe that is quite often, is that people many times have double stigma. People with hepatitis C are stigmatized as there are homeless people and people using drugs. And this is a double stigma. hepatitis B, it's mainly still important among the sub-Saharan people and migrants from Eastern Europe or from Asia. So not only they bear the burden of being people living with hepatitis, but also the stigma of being from a specific group that is himself stigmatized and etc. Thank you.
All right, thank you, Luis. Thank you so much for sharing. I will now throw the floor open to members of the panel, members and audience. Please, if you want to share your story, you just raise your hand.
Recording in progress.
Okay, can we have Mickey? Can we have Mickey? Can we have? Is it only me that is not hearing?
I just want to share about this, that we stigma data that here in our but hello.
Yes, we can hear you, Mickey. Go on.
Go on, please.
Hello.
Yes, Mickey, we can hear you. Please go on.
I do have a research ANC, which is the times in 2000. What we go actually stigmatism, but being hepatitis do have some stigmatism to be said by the other people. So follow up positive, just and there was a lot of this might be we don't have centralized treatments, and so the discrimination, the stigmatism they don't.
It's very sad
being
that
patients of hepatitis.
We kind of really lost. I think you're not very audible, Mickey. I'm very sorry. I have to maybe ask the next person to speak. Kenneth, over to you. Just a minute, please.
Hello. Yes, thank you so much.
Unmute yourself? Thank you. Thank you.
Thank you so much, Danjuma, for giving me the opportunity. So
Personally, my experience started way back in 2013 when I personally tested for hepatitis B. And because I had just lost a friend to hepatitis, the first incidents that I encountered was the self-stigma. So I isolated myself because I was immediately put on lamivudine, tenofovir, and those HIV drugs. But because I knew they were HIV drugs, that in fact devastated my condition so further, because taking the HIV drugs when you are not HIV positive, that was something that was devastating. So what I did, in the first place, I accepted the situation that I was positive for hepatitis, but I thought that I should do further because this was a bigger problem than myself. So I started speaking out, and the more I spoke out, I felt I was so relieved. So I was not, self-stigmatized every other time I spoke to my friends, even when I lost some of them, because they had a lot of myths and misconception about the proper mode of transmission. So they thought hepatitis B was casually transmitted. So, but each time I talked about my status through the media, through my friends and the community, I personally felt as if I was, relieving the huge burden that I was carrying of stigma. So I think the best way we can fight stigma in our communities is to actually speak out, because the more you keep silent about your status, the more stigma you're going to create for yourself. And also keeping may not help you, but help the other people who might actually also be affected but not know their status. So I think speaking is one of the things that we need to use, but also using the peer group, peer kind of, especially using those patients who are able to speak out, to continue speaking to the communities that they actually live in. But more importantly, we have also seen that there has been a structural stigma and discrimination, especially when it comes to employment. Specifically here in Uganda, we have seen some employers terminate employees' contracts because of their hepatitis B status. So we need to push for the hepatitis B workplace policies that protect the hepatitis B patients from being terminated on their work, but also to appeal to government, because there are some governments, like in my own country, someone cannot join the army or the police if they have actually been tested positive for hepatitis B. So these are some of the structural policies that we need to push. I know it will take us a lot of time, but it is better than not starting to work on the policy issues that discriminate against hepatitis B patients. Thank you so much.
Thank you, Kenneth. You are also a very, very strong voice in Africa, and we appreciate the great work you do. So, gentlemen and ladies, we need to move on with the next panel, the next question. And well, my name is Dee also, and myself and Silvana will share our perspectives on the next question. So, Silvana, you're going to start. And the question is, what role does the community and advocacy have in prevention of mother-to-child transmission of hepatitis B, and what more needs to be done? So, Silvana, you're going to start, then I join you. Thank you.
Thank you, Dan. Well, actually, I can give a very short answer. It's the central role of the patient and of the community, because who will know better than us what we need to be done? So I think the government could not do anything without patients walking by themselves. I think patient voice and patient experience should be prioritized. And I would say that unfortunately for the past 2 years, we've saw great problems with vaccination in newborns because previously before COVID in Bulgaria, we had 95% coverage of vaccine among newborn. And only for 2 years, we've seen drop by 20%. So now we have 75% coverage with 3 doses of vaccine for Hep B. And for me, this is a great, great problem because we cannot anymore excuse our government for not doing anything because of COVID, because COVID is here, it will stay, and we need to prioritize hepatitis. And I'm really tired of not being able to see, running programs or haven't seen any major changes in my country and other countries because of excuses. So I think government should start act very, very actively. They have to be very aggressive, even if I can use this word. But also, I think patients should be actively be involved in this. And I think that we faced a lot of problems, not only with vaccination, but also with general awareness among medical specialists who take care of mothers who are pregnant, have newborns. We've seen resilience among gynecologists to put immune globulin to newborn mother, to newborn. And also we have so many problems, and I think that it's not only Bulgaria, we can see it everywhere in the world. So I think community should be involved in this, and we need to spread the word. And it's a cliche, but we need to raise awareness because awareness is the only thing that will move people forward, will move forward, programs and screening and vaccination, if you want. So, but I think the most important thing is to be able to know more about hepatitis, to self-manage your life, because if you're a mother who is knowing that she is carrying hepatitis B virus, if she's aware what has to be done, she will go to her gynecologist and push him to do the right thing, vaccination, and probably if needed, immune globulin. So I think we are not different universes, where the whole community should be involved in that. And I'm not going to speak about our work because I'm sure many other organizations are doing the same. But we try to support patients with education. I think, okay, we have the screening, we have the linkage to care, we have those programs we are doing in our organization for the past 7-8 years. But I think the most thing that is essential is to provide information to patients, because otherwise everything will be lost. Because if not, the patient is, if the patient is not empowered with information, we cannot rely on medical specialists. We saw that. So I think we as community, we have the obligation to spread the word and just to help each other with information, with support, with psychology support, with emotional support, with any kind of support we can lend. We have to lend each other a hand, and we should support ourselves. And I can speak for many, many minutes, but I guess I don't have much more time.
All right. Thank you, Silvana. It's great to hear your story and your perspective. Thank you so much. So I would like to also share the fact that, yes, patients and civil society play a significant role, especially in low middle income countries where healthcare service, we have people living very distant communities to healthcare facilities, and then where people have to move long distances to visit hospitals. So those cultural barriers, like in some countries, regions, and communities in Africa, where the women have to take permission before they even go to hospitals. So those cultural barriers need to be broken. And I think that is why civil society plays that significant role, and patient groups. And then, like you said, demand creation, we have a role to play there. in raising awareness, moving our patients, trying to break those cultural, religious barriers to ensure that people access the services that they need. Because in some communities, for example, in Nigeria, the women have to take permission from their spouses, from partners, from relatives before they even go to facilities. And then women who also deliver outside hospitals. So that we have this very big role in triage and linkage to ensure that pregnant women have access to Pmtct services. So I will stop there, but I would like to use this opportunity to inform us of what the World Hepatitis Alliance has been doing over the past 1 year, over the past several months. On July 26th, we are going to launch what is called the Pmtct white paper. And that is going to be launched on July 26th. So be on the lookout for that Pmtct white paper, which the WHA is going to launch formally. A lot of thought, a lot of research, and a lot of community consultation has really gone into that. So I would like to call the panelists also to share their thoughts on Pmtct. Maybe 1 minute briefly, any panel member who want to share their thought on HPV Pmtct. Please, could you maybe raise your hand? Dee, okay, I'll start with you before I go to Lien. Thank you.
Thank you for the wonderful experience to share. I have questions instead. Because most of the time when dealing with the stigma discrimination against the pregnant woman with living with hepatitis B or C, are literally from the families. So it's not just about how the pregnant woman having the self-stigma, and science can explain to them for everything that you can have the baby health and safe and sound. But how can you deal with the families when it comes down to in the countries or in the cultures that babies, the next gen, the teens are basically the top of the world. They don't want any stain on their babies. How can you tackle that?
Okay, Dee, let me say this, Dee, that I will start maybe Silvana or any other panel member or anybody in the group wants to share their thoughts. I think Pmtct perhaps provides us one of the greatest opportunity to access families, to access even financing on hepatitis elimination. For example, it could give us, we could borrow a lead from HIV where index testing is done to reach up. Sorry, can you hear me very audibly well? Okay, my internet is, please, you need to just pardon me, my internet is really very unstable. So HBV Pmtct gives us the opportunity for entry as an entry strategy into families. We could borrow a lead from HIV where you do index testing. So it could give us the opportunity to test the partner or the spouse of the woman that is pregnant. It could give us the opportunity to identify older children in the home that might likely also be positive. So it could give us a whole lot of opportunities to test families as a whole using the family-centered approach in providing care. So it also gives us the opportunity, of course, to piggyback into maternal and child health. So it's one of the lowest hanging fruits in addressing hepatitis as a challenge. And using the family-centered approach, it could also provide us opportunity to break the stigma. We could use that to get the partner, the spouse, and the entire family. And that would really help in addressing challenges around stigma. And more so with the poor information people have thinking hepatitis could be spread through casual contact. So I think HBV Pmtct really gives us opportunity to really lot of hepatitis landscape. I don't know, Dee, I don't know if that addresses your question, or if any other panel member would have to add to this.
Yeah, I would like to jump if it's possible. Of course, stigma, it's not only in society or among medical specialists, it's in the family too, even in ourselves. So what we've been doing for the past 10 years is that when we have when we are approached by a patient who has experiencing stigma in their family, what we are doing is that we are trying to connect with the family. We used to have support groups for patients and their relatives for like 10 years. And when we have patients with problems like that, we just invite them to see us in real and realize that, and we share our real life experience. For example, like if someone is have the fear that will be infected by a spouse with hepatitis, we just provide the safe space for people to meet and to share their experience. And when somebody hear that, in this family, somebody is living with hepatitis for 25 years and there is no infection among the other members, I think this relieves their tension. So first, I think people should hear real life stories and realize that hepatitis is not spread in that way. And also, I really do think that what the World Hepatitis Alliance is doing with the No-Hep supporters is that when you hear stories of patients who just overcome the stigma in themselves or in the society, you feel empowered to do it yourself. Even if you don't manifestate that, even if you just simply realize it, I think this will help you. When you see other patients, other stories, you will be inspired and you realize that hepatitis, it's not that danger as you may thought. So I encourage people who have this fear just to meet even online with other patients and share their experiences and realizing what is the real life with hepatitis.
All right, thank you, Lien. Let me ask, thank you, Silvana. Sorry, maybe Lien, I think the floor is yours now to share to give your perspective.
Yeah. Yeah, thank you. Thanks, Danjuma, and thanks, Dee. Actually, what I wanted to say is just like also cover a part of what you want to ask. I guess so acknowledging the women when they are pregnant, when they are carrying a baby in their body. So there's a lot of things happening. That's the time that they are the most vulnerable. So and on top of that, we see like the feeling of guilt, the feeling of like the worry that they can pass on that to the babies, and that actually created the self-stigma for the moms, that's for sure. But I guess I want to call on call for the support from family member, just like Silvana mentioned. So I think that's from the family itself, and also when we do all the programs, we include family members, especially the dad. So we need to make the family members knows about what the risks are and how easy that can be managed. So there's information about prevention of mother-to-child transmission. All those measures, all those guidelines are available. So it's just like make sure that women are tested, and then the women and their family knows about the risk can be managed. And then making sure that the women have the support from their partners, from the family during the hardest part of their life, carrying a living little baby in their body. So yeah, I guess call on like a whole family approach that will address the women themselves. Yeah. So thank you.
Thank you, Lien. Thanks a lot. So we move on to the next. Dee, I hope that really answers your question. Sorry for the audience attendees, my apologies. I might not throw that open now, but if you have something to contribute to this, please just help us drop it in the chat box, and that would be awesome because of our time. So we go to question 3. David Urick, this question goes to you. And the question is, what can be done to better support people living with hepatitis and their mental health? What can be done? What can be done to better support people living with hepatitis and their mental health? So I want you, David, to share experiences of hepatitis diagnosis at your young age and the impact on your mental health. Thank you, and David, over to you.
Thank you, Danjuma. I'm just going to share briefly sort of my journey through my diagnosis and the mental health care system. I was taken to see a liver specialist at the age of 13 after being told by my adoptive parents for the first time that I have chronic hepatitis B. I remember being told that some general guidelines for taking care of my liver, these included avoiding alcohol, staying fit through exercise and diet, and keeping up with doctor's appointments. To me, these were important questions, but not the ones that I wanted answers to. I remember feeling frozen in place with anxiety through that entire meeting, nodding and muttering in agreement when asked if I understood what was being told to me. So many negative thoughts raced through my mind, too quick for me to grab onto one and think on it deeply. I don't remember being asked if I was okay or if this diagnosis was upsetting to me. I felt so scared, while at the same time, I started to push everything into the back of my mind where it didn't hurt to think about as much. After I left the clinic that day, the negative thoughts that were racing slowed down and became somewhat clearer. I thought to myself, how will I ever be able to tell anyone I know about my diagnosis and future as a hepatitis B patient? My response internally to that was, I'll just never tell anyone and I'll stay alone for the rest of my life as a patient. I gave up on the possibility of finding romance or love. I no longer cared about my education and career opportunities and completely withdrew from school. When I did return to school after a winter break, I isolated myself immediately, didn't communicate with my teachers or friends. During summer break, I feared going to high school, and I started to fake being sick every day once school started so I could stay home. I was in purely survival mode at that point in my life. There was a winter band concert I was supposed to play trumpet in, and I remember that all the bad feelings I had felt since my diagnosis came to the forefront. And I remember thinking that no matter what, I couldn't move on with my life, and I didn't want to be alive anymore. So what I did was I found as many paracetamol pills as I could in my parents' medicine cabinet. I took them all, and I didn't tell anyone what I had done until we had started to pack for that concert. Of course, my parents' reaction was pretty extreme, and after my suicide attempt, they took me to a psychiatrist who then referred me to a therapist and got me on antidepressants at the time. This was definitely one of the lowest points in my life. I spent the next 15 years picking up the pieces from that moment. I was put into therapy multiple times and tried different methods. Unfortunately, problem with the mental health system is that it's very disconnected from the medical system in the United States, to whereas therapists aren't in communication with doctors. Qualified therapists is essentially you just picking a name out of a hat and hoping that it works out. Changing therapists and insurance is extremely difficult and challenging, especially as a teenager. And I remember having multiple years where I just completely disengaged from participating in doctor's appointments or therapy appointments at all because it was just too overwhelming. In my 20s, I moved to self-medicating with harder drugs, cocaine, oxycodone. I began to use syringes to inject these drugs to further my addiction and sort of run from all these feelings that were just so buried deep inside me at that point. Through my 20s, I would fall in and out of depressions where I would completely lose track of my life and my social circles and my support networks. I wouldn't see my hepatologist during these times, and I had absolutely no idea how my liver was doing at any given moment. And that, as a patient, is one of the worst places you can be because you're essentially denying a chance for you to live a healthy life at that point. I still deal with depression and anxiety. It's not something that just went away magically, but I am better equipped with tools today to take care of myself. And what I do find is that a lot of the principles that we follow as hepatitis patients to, manage our condition and take care of ourselves are very reflective of a lot of the techniques that people use to maintain their mental health. I still go to therapy. I talk extensively with my support network whenever something is going on internally with me, because as patients, I know sometimes it's easy for us to isolate and to not be able to have that olive branch, so to speak, of people that can relate to our struggles, which is why I'm so happy to see now all the forums that exist and all the sort of community-based patient networks that are popping up all across the world. As far as supports go, what I think I could have needed and others might need, I think that multiple supports were needed to help with my depression and anxiety and possibly prevent that initial suicide attempt. My parents were caring enough to bring me to a psychologist, psychiatrist, and a therapist. But the unfortunate part, as I mentioned before, is none of these mental health care professionals were really equipped to talk to me about the core of my issues, which is hepatitis B. I thought the therapy sessions were pointless. Medication was hopeless because the core reason for my depression and anxiety wasn't being addressed. I had so many hepatitis B related fears that continued to replay in my mind over years, and I was never able to fully flesh that out and talk about them in a productive way. I think we could create a model in as many countries as we can. I'd love to see something like this, where patients are getting referred to quality mental health care services that are equipped to serve them immediately after diagnosis with the high level of privacy and dignity that I believe that all patients deserve. I think there's a need to create standardized lines of communication between patients, providers, relevant mental health services, so that people don't fall through the cracks like me and receive only partial or incomplete care. I think that qualified hepatitis advocates around the world should be empowered to potentially meet and speak with the newly diagnosed in order for a larger community network of care to be built from day one, so that people don't feel left behind or alone. I think this would be better suited for a non-clinical setting if possible, but that's something I could have really used as a 13-year-old. I think if I would have met with someone that has this lived experience, I'm not guaranteeing it would have changed my life, but I think it would have given me a different perspective and just some more positivity to reflect on back then, which is what I needed. And as far as the impact of me sharing my story like this, very near and dear to my heart. In 2019, I received a liver biopsy and started taking medication. After starting the medication regimen, I felt like I was taking care of my health, but I still felt like I was disconnected from my status as a Hep B patient. If it wasn't for a hepatitis B patient sharing her story publicly through a video from the Hepatitis B Foundation a few years ago, I wouldn't be here sharing my story today. There's no better way to feel less alone to me than to feel connected to another person that can directly relate to your struggles. Hepatitis advocacy work was an afterthought in my mind until I really saw and understood that real people, besides myself, are negatively impacted by this. It brought forth a feeling of gratitude and purpose from deep within, and the momentum didn't stop there. And I just feel connected every day with the hepatitis patient community, and I feel the need to share my story and help spread awareness in any way I can.
Awesome, David, thank you so much. Each time I listen to your story, I really feel moved and touched, and this is awesome. Thanks a lot, David. This is wonderful, and I think it's great that maybe as a community, maybe it's good we have regular forums like this once in a while, so as to really have this beautiful storytelling. Thanks a lot, David. You are really quite an inspiration. It's glad we have you on this panel. So I'm going to ask maybe audience, if you want to share your thoughts on mental health and how a patient could be assisted to help with mental health challenges with hepatitis. So the floor now is open to members of the audience. So patients, Timta, the floor is open. Okay, David Kloon, go ahead, please.
Hello?
Yeah, we can hear you. Go ahead.
Okay. David, I could relate to everything you spoke about there, brother. And there was some great information in there. I come and I live on country where the indigenous people of this land have been here for 35,000 years. And I've learned so much from them and their way of life, which has played a big part in where I am today. And, you know, it's at 64 years of age, and from when I lived on the streets as a 6-year-old, I look at and when I tell most people that 6 years old, they just can't relate to it. So my whole life has been like a merry-go-round, you know, going through the child abuse and state care, and 40 years of probably very rarely there wouldn't be a week that I haven't been in hospital over the last 30 years. And in that time, in that 40 years, nobody has, until recently, until I actually took the action, had ever asked me about my mental health. And it only come out of COVID when things changed, because I was so busy. I tried to keep busy all my life because I just wanted to see 5 more years from when I was 20. I just wanted to get to 30. Then I wanted to get to 35. Then I wanted to get to 40. Then I was dying between 40 and 50 before I got my transplant. Then I only wanted to live 5 years to see my grandchildren go up. And that through this whole journey, even through all my transplant doctors, and I go to 8 clinics now, not one ever asked me how my mental health was. And it wasn't until I bought it, pretty much announced it myself in 2019 when COVID came, where I was housebound, that my history come back to me, and it captured me, and it started to eat me out, and I had to reach out for help. And this is like 13 years after I had my transplant, till 3 years ago. So now I have a trauma specialist psychologist, and it's the best thing I've ever had. And I say to all our patients, and I advocate for this everywhere I go in the community, everybody I speak to, get yourself a good psychologist. And you know, not even my transplant doctors ever ask me, have you seen a psychologist for support? Not until I went to them in 2019 and said, look, you tell us all us people that come into hematology and that you've look like me, that you've looked after for 30 years, and you tell us, have you had your flu shot every year? Have you done this test? Have you had your skin test every year? I said, start adding onto that list your psychologist every 6 months. And they're just starting to do it. And that is the number one, that's the number one thing, is that mental health. I don't know how I got to where I did today. I really don't. I've got doctors that shake their head when they see me and smile that wide when I walk through the hospital. And I say to a lot of people out there that live with liver disease, and I see a man in here now that is struggling, that I can see amongst us people here. And when you're in real trouble fighting for your life, just draw on that strength that you've got inside, because it's there. Thank you.
Oh, thank you. Thank you, David. Thank you so much for, once again, this very inspiring, heart-touching story from your end. And thanks a lot for being there for the community, and thanks a lot for standing in the gap to share your stories. And I just hope this really will inspire others. It inspires me listening to you. And I hope this will really inspire and motivate people to help us break the stigma on hepatitis. So we will go on to the next question. And Luis, you'll be the next person to respond. And the question to Luis is that, what are the needs of people living with hepatitis and other conditions? How do we better support people holistically? Luis, you have 3 minutes for your discussion. Thank you.
Thank you so much. I think I agree with the slogan that hepatitis can't wait, and can't wait for elimination by 2030. And the second thing is that I believe that we should focus on reaching the intermediary goals in 2025, so we know where we are and the journey that we have to go. Another thing that I believe is that prevention, diagnostics, treatment, stigma, elimination, access to health care, and support, and vaccinations, that's key, absolutely key for hepatitis B, cannot be done without the full participation of people living or at increased risk of living with hepatitis, viral hepatitis. And this is not just a slogan. It's true that services provided with the input and the participation of the community reach out better to people, that self-support among peers, it's many times absolutely key for the control of self-stigma and stigma among peers. But as I've been a big part of my life, someone looking for the research and innovation and investment in diseases, and especially in hepatitis C and B, I think that we will need to have full commitment of all the stakeholders, including financement and investment in research and development. So needs that I think we still have and could be better with adequate investment. The 3-dose vaccines would be much more effective if we could reduce the vaccination for 1 or 2 doses. And there are things in the market that we may need to make available to everyone, not only for countries or people that can pay these interventions. A simple thing like diagnostics, the point of care diagnostics for hepatitis B, it's very inadequate. We can only see antibodies, the prompt confirmation of active hepatitis C, it's difficult, and when available, it's too expensive. So we need to move also in front there. I believe that everybody now it's looking for a functional cure and eventually, in the end, a cure for hepatitis B. We have 250 million of people living with hepatitis B that would be extremely relieved if they would see a functional cure in perspective. and we need to fight, of course, then when we will have that disease don't leave no one behind, and it's reachable regardless of in which country you live and regardless of your economical situation, etc. Remember that we still don't have a vaccine for hepatitis C, and I'm deeply convinced that if there would be additional investment, we could find a treatment for hepatitis C by a long-acting mechanism, meaning that it could be treated in 1 shot or 2 shots instead of 3 months, maybe 2 months, sometimes a little more. So the other question that I believe, and I'm finishing, we need to work together to have and to put pressure, and nobody can substitute people living with hepatitis to put pressure on that, is that we need to know our epidemics. We need to know reliable data that is comparable among us and where we are and where we need to be. We know where we need to be in 25, where we need to be in 2013. The elimination of viral hepatitis as a public health huge problem. The other point that I believe we still have needs for innovation and research and innovation and access, it's for the complications that derive from living with viral hepatitis.
Luis, can I ask you a question?
Yes.
Luis, can I ask you a question? In the context of integration, you are a shining example of living with both hepatitis and HIV. What can you say if, as a patient, what experience can you share? What can you tell us on how important it is to have an integrated service or diagnostics platforms or integration of services for people living with HIV, hepatitis, or for populations? What can you say about that?
Yes. I think everybody is agreeing that integration of people with multiple conditions, and many times not even only the co-infected like me, but the comorbidities that are associated with different services, and they should be combined and accessible. I will say something that is not on my scientific movement, but that I feel it's very important, and I heard your stories. It's that the services are very good in quality, but also humanized. Because I remember stories in Bulgaria many years ago that I hope it's overcome, that there are services that really people feel bad about. And this humanization, together with the quality of the services and the integration of services, is fundamental. For instance, I work a lot with people using drugs. We cannot put people using drugs to have their TB treatment in one place, their methadone or buprenorphine in another, their treatment for hepatitis and HIV in different sectors, etc. This will not work. But I think that the need to identify which are the priorities, for instance, for
All
me.
right.
Yes.
All right. Yeah, Luis, thank you. I'll need to cut your story short then. And imagine a scenario like this, Luis and everybody. Tenofovir is prescribed for people with chronic hepatitis B, and is the same medicine for HIV. But while this drug is available for a person living with HIV, this same medicine is not readily available for a hepatitis B chronic patient. So that is the world we're living in, especially across most of our countries and regions in the world. And we hope that the Global Fund and all partners will take up this challenge to integrate these services and ensure that no one is actually left behind. So I'll call the panel members to maybe share just one minute because we're running behind time. And maybe the members of the audience, if you want to share maybe just a minute on integrated services. What are your thoughts on integrated care for HIV and for hepatitis? So panel members and then the audience, 1 minute each, please. Okay. I can't see. All right, Justin, go ahead, please. 1 minute. Justin and Michael, 1 minute each, please.
Allô?
Yes, we
Vous
can hear you.
m'entendez? Vous m'entendez? Allô?
Oui, we can hear you. Go ahead.
OK. Merci à tout le monde. Et je pense que le VIH, voilà, le programme du VIH a beaucoup d'acquis pour moi et qui pourrait vraiment faire avancer l'hépatite. Et par exemple, si on prend la Pmtct, VIH, je pense qu'on peut intégrer aussi l'hépatite dans ce sens et qu'on puisse sensibiliser les femmes sur les femmes enceintes qui viennent pour la consultation prénatale sur le VIH et pousse en même temps sur l'hépatite. Je pense que c'est un point important qu'il faut exploiter. Deuxième point qu'on pourrait exploiter aussi, c'est la charge virale. Nous savons qu'on a des automates qui font la charge virale du VIH. On pourrait aussi profiter pour faire la charge virale de l'hépatite. Ça pourrait avancer beaucoup les choses. Et bien sûr, il faut former les gens. Il faut vraiment former les gens. Et le problème qu'on a en Afrique ici, comme on l'a dit et dans beaucoup de pays, c'est le problème de financement. Voilà, le problème de financement s'oppose du fait que nos plans nationaux, voilà, stratégiques et nationaux ne sont pas financés. Ça fait que voilà, nos autorités sont là et ils profitent des occasions avec des partenaires pour intégrer des choses sans prendre le problème, traiter le problème de façon globale. Sinon, j'ai tout suivi, la stigmatisation, et comment les problèmes, comment l'accompagnement psychologique des patients, tout ça là, c'est un truc qui doit être traité de façon globale, qu'on a un plan bien structuré, hein, et profiter des acquis du VIH pour intégrer ce qu'on peut intégrer pour avancer. C'est ma manière de voir les choses. Voilà. Donc, je vous remercie.
Thank you, Justin. Thank you so much for the great work you do also in your country. So, any other members of the audience to share your thoughts on integrated approach, or any panel member? Okay. All right, Prince Okinodo, it's up to you. Just 1 minute.
Okay. Thank you very much again for this opportunity. Here in Delta State in Nigeria, I think will be be of immense help to this.
I'm not sure we can hear you. I think we've lost you there. Okay, Prince, are you still on? Can we have Michael? Let's have Michael. Can we have Michael, please? Michael, please. You're unmuted. Share your story. All right. Am I not the only one that is not hearing what Michael is saying? All right. Very sad. I'm not sure we have connection. Okay. I think we just have to proceed to round up this beautiful call. Okay. Do I have one, David? All right, David, go on. You'll be the final person who permit to speak. David, please, you're permitted. Go ahead.
Hi, can you hear me okay?
Yes, please, go ahead. Please, proceed.
Sure. I just wanted to say a word of bravery and just being courageous and sharing the stories. I can share my story as well. I had hepatitis through maternal child transmission, but I was unaware of it. I do wanted to talk about the co-infection with HIV and Hep B. The reason why I found out about my Hep B was because I was diagnosed with HIV. And of course, that was a life-turning event, as you probably can imagine. And through that multiple kind of lab workup and diagnostic work, that was when I found out I needed a liver specialist, because I didn't realize how bad my condition was. And I was on the transplant list. So just imagine kind of my mental state of mind managing two co-infections that are pretty deadly. But fast forwarded, I think I wanted to comment, my younger brother was also undiagnosed and not aware of it. It's lack of awareness. So the need for screening is critically important. Unfortunately, my younger brother passed away on July 31st, 2017, due to secondary to liver cancer from Hep B. So I'm passionate, I'm an activist. And what I wanted to talk about is there's so many opportunities with mental wellness in combining that or integrating that with medical care. Unfortunately, in the states where I live, is that there is a systemic structural kind of barriers in integrating the data, just like the data, not just even the coordination of providers and specialists. I also think that it really is on the burden of the patient, unfortunately, to facilitate and really make that happen, if you will, just because there's still systems that do not connect. There's not even sharing of information. There's not even knowing what this specialist is doing on the same body, which is your body. So I think a lot of it is the ownership of all of us taking care of it until our healthcare system catch up with being more integrated, more coordinated, more getting transparent also what we do. The topic of stigma is really concerning to me, just because it does take bravery to share your stories, any stories, because it's already hard as is to manage your medical care, certainly more challenging to also manage your behavioral health or mental status. But on top of that, societal stigma makes it even triple kind of burden. So just wanted to continue to say great work for all of those who are being an activist and sharing the stories, because it takes people personal stories to really understand and appreciate that we do need to be more kind to one another and really educate. I think it's education to help with stigma. So thanks so much.
Oh, thank you, David. And our condolences for losing your brother. And thanks a lot for sharing your story. And thanks a lot for standing in the gap. And then it's great to have advocates like you to really be the shining example and sharing your stories to break the stigma on hepatitis and of course on HIV and other diseases. So I think we are past a little behind time. As before we round up finally, I'm going to ask every panel member to share your I can't wait message for World Hepatitis Day. I can't wait message for World Hepatitis Day. I will start with Dee Lee, what is your I can't wait message for the World Hepatitis Day?
I'm going to just focus on the stigma discrimination. We keep saying that time is the best cure for mental harmness, but in my experience, we just can't wait. So my single message is time will tell, but I can't wait.
Thank you, Dee. Lien?
Yes, I guess as a person who have seen opportunities taken away from myself and many of my friends, so I guess I can't wait to see normal life opportunities be returned to people living with hepatitis.
That's powerful. Thank you. Okay, Silva. Yeah, Silvana, it's your turn.
Yeah, sorry. I was just thinking, I would like to say one thing that I can't accept more excuses for neglecting hepatitis, and I want to see my government to act now. Because I truly believe that we've been waiting for so long, and this has to stop. We have to act now together.
Yeah, we've waited for so long. Absolutely, yeah. I can't agree more. All right, Luis.
Well, I would say I can't wait for a world hepatitis free.
Okay, David.
Good. Short and sweet. I can't wait for a world where all hepatitis patients are given access to quality and affordable mental health care.
Perfect. Okay, I'll round up with my I can't wait. As a person living with hepatitis B, and I've shared my story that living with hepatitis B can be very traumatic. Like all the beautiful stories we've had from all the panel members, and you keep having the fear of you could develop liver cancer, you could have liver problem, and your liver may pack up anytime soon. And then, unfortunately, we are being bombarded with a lot of multiple treatment guidelines, multiple documents about not initiating treatment. And the scientific world will keep telling they're waiting for evidence. And then so a lot of confusion to the patients. So I can't wait to get cured of hepatitis B. And I can't wait to see that all the funders stop the excuses for not financing hepatitis. And I can't wait to have increased financing for hepatitis. So first on the list is I can't wait for hepatitis B cure. And I know that is a push for majority of patients with hepatitis needs to get cured and to end the stigmatization with hepatitis. So I want to sincerely on behalf of the World Hepatitis Alliance, thank you all the panel members, but I want to urge all audience and everyone, please check our website, worldhepatitisday.org, and make your pledge and get involved with World Hepatitis Day activities. This is the first of the series of activities we have to mark this year's World Hepatitis Day. And please, in your communities, wherever you are, let us know what you're doing about this World Hepatitis Day. Share your stories, share beautiful pictures and videos of the activities you're doing, and let us make stories, let us make history by pushing advocacy, talking to governments. Silvana said we have waited for so long. Lien, we have no more excuses from government. Lien said we've seen opportunities taken away from people. So we need to come as a community and raise our voice. We want to see the traction on our website. We want to see tweets about World Hepatitis Day. We want to see messages in millions going out about hepatitis. You see, I can't just understand why funders are not thinking about this disease that kills 1.1 million people every year. It's really, really, really something one can't just imagine what goes through the minds of the funders and global people that are financing hepatitis. So governments, lack of energy, lack of commitment at all. But our stories might make the difference if only we put our pool resources, pool our voices and push for hepatitis elimination. So thank you so much, everyone. We sincerely appreciate you all. On behalf of the World Hepatitis Alliance, our wonderful team that have put this up, I want to say thank you. And please, let's make this World Hepatitis Day a memorable one so that we move the needle and shake the tables about hepatitis across the world. So thank you, bye-bye, and thanks a lot for being part of this. Thank you and have a nice day.
Bye.
Bye, everyone. Thank
Bye,
you.
bye, bye.
Bye, community.
Bye, friends.
Yes, bye.